Hi there, this is Dr. John from the Florida Center from Hormones and Wellness. And I wanted to just briefly talk to you all today about a really important topic in women's health. I'm sure many of you may know that heart disease is the leading killer of women over the age of 50. That is, once women go into menopause, heart disease becomes the major cause of death. And it's something that we spend lots of time on, we go to the doctor many times for, and we spend billions and billions of dollars trying to treat. So wouldn't it be wonderful if we could figure out a way to reduce the incidence of heart disease? And there is. We think in traditional medicine the way to do that is to deal with cholesterol problems. The way that traditional medicine deals with cholesterol problems is with statins. So the average doctor visit when we're dealing with cholesterol and statins kind of goes like this. They'll measure your blood, they'll find out that you have high cholesterol, and within about a 2 or 3 minute discussion, the doctor rolls out on the table like a piece of candy some statin, okay? And it's just accepted that that's the way that it is. But there's a big problem there. If we look very closely at the medical literature, what we're going to find is that while statins may lower cholesterol to some degree, there is no real solid medical evidence that they reduce primary development of heart disease. So you ask this question, I may lower cholesterol, but I'm not affecting the outcomes in terms of heart attacks or cardiac death. So even though I'm lowering cholesterol, am I really accomplishing what we're trying to do, that is reducing the risk of heart disease? Sadly, that answer might very well be no. And it's even worse than that if you really want to be honest about it. If you look at statins, they have been shown in many studies to cause a lot of problems. They can affect blood sugar metabolism. They can cause brain healing to slow down. That is, statins have been associated with dementia and inability of, or they've been associated with dementia and some degree cognitive decline. They've also been associated with erectile dysfunction in men. And on top of all of that, there's some really good literature out there to suggest that statins, when used regularly in women, may triple the rate of heart disease. Now, I don't know about you, but I want to take any medicine that's going to triple the rate of breast cancer. I'm sorry, I said heart disease. It may triple the rate of breast cancer. But I don't know about you. I don't want to triple the rate of breast cancer. I'm looking to try to reduce the risks of breast cancer, which we can do with properly applied hormone therapy, but that's another story. But statins may increase the risk of breast cancer in women by 3 times. That's just astounding. But I have another alternative. You know what? The New England Journal of Medicine wrote an amazing article, or they didn't write it, but it was published in the New England Journal, that said that women who maintain hormone balance, particularly estradiol levels or estrogen levels, to use a common term, actually have as much as a 50% reduction in heart disease. Not only that, when you study women that take estradiol, you can reduce the amount of plaque buildup in their carotid arteries and in their heart. So estradiol given to women after menopause or as they transition through menopause and go into their aging years can actually reverse and prevent the progression of heart disease. With real numbers, not like the statins do, that maybe they do, maybe they don't, we don't know what their effect is on primary prevention. Estradiol, given properly to women under an expert watching eye, can actually reduce the risk of heart disease, lower the amount of plaque in the arteries, lower the narrowing of the carotid and the coronary arteries, and in fact, reduce the rate of heart disease and cardiac events. Now, I'll tell you what, that's pretty astounding. Not only that, but if you look at the effects of estradiol and properly balanced hormones, women live much longer lives, much happier lives, much fulfilling lives with a lot less illnesses of aging, things like macular degeneration, dementia, osteoporosis, sugar problems, cholesterol problems. So hormone balance in women not only lowers the risk of heart disease, it lowers the risk of a number of diseases of aging. So I don't know about you, I'd want to take another look at estradiol as a possible therapy. And it may be a little bit of unconventional advice, but there are no articles that show that properly applied bioidentical hormones cause any major medical problems that people, or women in specific, should be worried about. So this is Dr. John from the Florida Center of Hormones and Wellness, and I hope you enjoyed this little chat today about cardiovascular disease, statins, and hormones. Thank you.